Board of Health, Director Sue Rosa, Amanda Glasser, the whole entire Board of Health team. They work all year long, and they're a great partner in town. I also want to thank all of you for coming out. I say it every year, I'm going to say it again. We have to be able to talk together, to discuss issues together, to work out solutions together. So this has to continue. It's very, very important. If there's anything you take out of me talking tonight, it's this. The police department is here to help. You know, it's not TV. It's not, crime, crime, crime. We have our share of everything in this town. Nothing is more important than everybody's well-being. So whether it's the Board of Health, the fire department, or the police department, if you, a loved one, or a friend is in need, we want you to come to our facilities. We'll assign someone to help you, to facilitate moving forward in your life. We're not there to charge anybody, certainly not there to arrest anybody. We want people to be well. So what I want to do tonight for a few minutes, I want to just read some of the issues we're dealing with in town. Like Amanda said, this is not a big city problem. This is a every city USA problem, as this crisis knows no boundaries. In 2016, there was 36 overdoses in Chelmsford. 3 of them tragically fatalities. So far this year, we're at 32 overdoses, 4 fatalities. And that is residents and non-residents combined. This, as we all know, it's a public health crisis affecting our region and our nation. And as a region, I'm proud to say there's no higher priority than our collaboration and partnerships with this region. We work closely, not just with our fire department and our local Board of Health. We work through the whole Greater Lowell area. We work with the District Attorney's Office, with the Middlesex County Sheriff's Office, with, of course, the other police and fire departments in Greater Lowell Health Alliance, the Lowell House, Learn to Cope. We pool our resources together because alone we're not going to solve this. And it really is all about solving this scourge. Some other things we're doing in town, we have like a 3-pronged program we put in place a couple of years ago. First one is prevention. Prevention through education. The best way to stop the cycle of addiction is to have it never start to begin with. So I have a full-time school resource officer in the high school every day, working with the school department, school health, our Board of Health, talking to students and parents about the dangers of opioids, experimentation, and just overall substance abuse. That facilitates two-way communication. We've actually found out about students at the high school that are having problems, not necessarily with opioids, but maybe some experimentation issues from other students. And we've been able to intercede with mom and dad before it gets to be a problem. Second prong is enforcement. I think that speaks for itself. It takes enormous resources for us to try to intercede in these illicit narcotic sales, but it's important, and we'll do the best we can. North Chelmsford area has been problematic this summer. People jumping off of Route 3, that seems to be a corridor where we've interceded in a number of illegal sales, and in most cases heroin. Third prong is treatment. Early last year, this was the missing piece for us, and it was, in my opinion, it's one of the most important. We've put a program in place now that if we find out that a resident has overdosed in Chelmsford, we send a detective to that house to follow up with either that victim or his family to facilitate moving forward. We have partnered with a number of treatment entities, and we hand out cards, and we try to get that person and their family moving forward. We've also, just this year, or actually just December of last year, we started a multi-community grant with Tewksbury, Drake, and Berica. That grant, through the Greater Lowell Health Alliance, has allowed Chelmsford to obtain the services of a full-time medical clinician who is actually the level of a doctor. This clinician comes to Chelmsford whenever we need him to, as another resource for us working with families that are having substance abuse problems. We don't track the progress. All we do is we tell the clinician, please reach out to this family. If they want the help, great. If they don't, that's fine too. It's just one more resource. I think moving forward, that's what we have to focus on. Just getting people in a place where they feel comfortable with a two-way communication, because we want nothing more than this town and this region to be well and move forward. And although Greater Lowell is seeing some positive factors, these numbers don't sound good, but believe it or not, they are trending down. In 2016, there were 215 fatalities. 168 of them were heroin-related in Middlesex County. And so far this year, there's been 103 fatalities, 98 of them heroin-related. And I meet with the district attorney every month at our task force meeting, and the trends are positive for Greater Lowell. But there's a lot of work to do. As I said earlier, Chelmsford's numbers are still problematic. So there's a lot of work to do. We have now fentanyl and carfentanil entering the picture. Extremely dangerous for first responders. I have now had to order personal protection equipment for my officers, which basically is a spacesuit. Because you might have read about what happened in Chelsea about a month ago. Police officers came into contact with carfentanil and needed to be hospitalized. We are now putting extra Narcan in the cruises, so there's one available for the officers. That's where we're at. So there's a lot of work to do, but I think better days are ahead. And again, we're here to help. If we can do anything for you, please let us know. Thank you.